end this video we are going to talk about overjet. Sometimes you might hear your dentist mention this term. So what is overjet? Is this a normal tooth position?
Hi, this is Dr. Gilbert and join me in this short video. An overjet is a condition in which the top front teeth protrude outwards, past the bottom teeth. This makes the upper front teeth more forward in position in relation to the lower teeth. This condition can result from numerous factors like underdevelopment of the lower jaw, or overdevelopment of the upper jaw. It can also be caused by flared upper incisors or missing lower teeth. You can also get an excessive overjet by combination of all the problems mentioned. This abnormal upper and lower front teeth relation can be also hereditary. This means that you can get this condition from your parents. If they have these problems, then you can have these problems also. When your dentist say you have a big overjet, this means that your front teeth are too far away from your lower teeth. An excessive overjet might cause problems with pronouncing sounds, or this may affect the speech of a person. There is also a greater risk that the front teeth might get chipped or broken. It is also considered unattractive in some countries. This condition often causes some psychological effect, as it causes those with it to feel very self-conscious, and they often force their mouths closed in social situations. Big overjets or protrusion of upper incisors can affect the facial structure's harmony. The reason is forwardly displaced upper incisors can cause the upper lip to protrude forward. This gives an appearance of a pointed lips, which can cause a decrease in the self-esteem of a person. As we all know that teeth problem can produce psychological effect on a person. This kind of problem can be treated by our orthodontic treatment, wherein the lips and upper teeth can be retracted to produce a more attractive lip profile. Let's take a look at some illustrations, to give you a more clear picture of this condition. If you have big overjet, your teeth will look like this. The upper incisors are too far away from the lower incisors. According to a lot of books, the normal overjet should only be 1 to 2 millimeters. It should look like this. Normally your teeth should be a little bit ahead of your lower teeth. If your upper incisors are directly on top of the lower incisors, this condition is called an edge-to-edge anterior bite. This is not a good situation also. This can cause the incisor edges to wear out. An underjet is the reverse of an overjet. This means that the upper incisors are too far back in relation to the lower incisors. So if you have an excessive overjet, an edge-to-edge bite and an underjet, I would suggest that you have these problems corrected by placing orthodontic braces. As I have mentioned earlier, that this condition can be inherited, so if you have an increased overjet, then it is very important that you try to observe if your children has an excessive overjet. Every child should have an orthodontic checkup before age 9 years old. Why? Because excessive overjet can be effectively treated when diagnosed early. We can guide a child's tooth eruption, and use growth to our advantage to correct overjet problem. Adults with excessive overjet can also be treated to get a normal overjet. Orthodontic treatment can be used to improve their aesthetic concerns. Some common symptoms of an increase in overjet are improper teeth alignment or positioning. This makes your teeth look too forward, giving it an illusion that they are too big. Another problem is person with this condition has inability to close their lips when they are relaxed. They also experience mouth breathing, instead of breathing in their nose, and this can cause additional problems in your teeth. They develop speech problems, or in pronouncing words. Plus increase in overjet produce unbalanced facial appearance. If you or your child have any of these signs or symptoms, then schedule a visit with your dentist, or orthodontist to determine the best course of action. Some common treatment that can help you achieve an ideal overjet are metal braces. But before your braces are applied, you may need to have additional treatment first. A good example would be a Carrier motion appliance. I will discuss this in some other video. For now, let's stick to metal braces. Metal braces have been improved a lot over the past few decades. The brackets we are using now in our dental clinic are genuine and made with high-quality materials. The brackets are much smaller to make them less noticeable. We use brackets which are almost pain-free. This genuine high-end brackets moves and correct teeth problems like overjet rapidly. This is how an incomplete treatment of an overjet looks like. If your teeth with braces looks like this, then this means that your upper front teeth still needs to go more backward and nearer to your lower teeth. A corrected overjet should look like this. The back part of your upper front teeth should lightly touch the front part of the lower front teeth. You can achieve this by following your dentist instructions and visiting your dentist regularly. Just think the many benefits of your treatment, the hard work you put in, and the more you follow your dentist or orthodontist, the better your results would be. Wearing braces is just a short adventure, but in the end you will have a great smile. For your inquiries about our genuine and high-quality brackets, you can schedule an appointment with us, and we will discuss the treatment options. You can visit our FB page Cabinsag Dental Clinic. Set an appointment for consultation. You can also contact our number 09338565654. Share this video to your friends and give us a like, and if you love learning new things, subscribe to our channel and click the all bell button. This Dr. Bird again saying see all of you again in my next video, and remember to stay safe all the time.